My name is Joshua Prager, MD, MS. I'm director of the Center for the Rehabilitation of Pain Syndrome, CRPS, at UCLA Medical Plaza.
My name is Karima Hirani. I'm a board-certified family physician. I have a master's in nutrition from the School of Public Health at UCLA, and I have a very integrative medicine practice.
My practice is predominantly patients with severe neuropathic pain, although I have a general variety of pain patients.
A good portion of my patient population is made up of autistic children, and I utilize a biomedical approach to treating them, which includes diet, nutritional supplements, heavy metal detoxification, and most recently neurofeedback. I've had one parent report to me that so far this has been the most helpful for their son. So improvements all across the board, from language, eye contact, socialization. So parents, I have yet to get one parent that will tell me that the neurofeedback was of no benefit to them.
First heard of neurofeedback more than a decade ago, and the idea of it intrigued me. The thought that you could actually modify a patient's experience by teaching them to modify their brain waves was very exciting for me. How I incorporate neurofeedback into my practice is an interesting question. I think anytime somebody has a tool, if that's the only tool they use, they make a big mistake. And the key to successful treatment of a complex problem like a human's pain is to use as many appropriate tools as possible and use the best tool at the best time. When you have one tool and that's the only tool you have, it's like seeing the whole world as a bunch of nails and you're having a hammer in your hand. I don't think neurobiofeedback by itself is a tool that will solve all problems. It's a tool that we incorporate as part of interdisciplinary care.
I recommend a minimum of twice a week. Most of my kids are doing twice a week. A few kids do 3 times a week, but you don't have to do it every day. And so that's what I love about the results, is that I'm seeing results, just doing it a couple of times a week or even once a week.
The results I've seen with neurofeedback are variable. We can have very dramatic successes. We have patients where it doesn't work at all, and we learn rather early on whether the tool will be effective for a patient, and if it is, we use more of it, and if it's not working, then we discontinue it after several sessions. The advantage of neurofeedback over many other forms of therapy is that there really are no appreciable side effects. When you take a medicine, there are usually risks associated with most medications. There are side effects associated with many medications, especially ones used to treat pain. Neurobiofeedback is a technique that basically doesn't have side effects. I mean, either it works or it doesn't work, but you're not subjecting the patient to any risk whatsoever. I've been using biofeedback for about 20 years in treating pain patients, and that included temperature biofeedback, muscle tension biofeedback, sweat biofeedback, all trying to reduce a marker and teaching the patient how to reduce a marker. When I first started using neurobiofeedback, I felt a quantum leap in terms of efficacy, because now we're actually looking at brain waves, or the technician is looking at brain waves to try to modify the pain experience of the patient. And we've had a whole multitude of different kinds of patients, but the patients with severe nerve pain, especially when there's anxiety associated or sleep disorder associated, tend to respond to this therapy.
I know that I have a lot of colleagues that are skeptical about it. And I mean, I teach at the USC Medical School. And so I teach first and second years. And so they're very green, and, their focus is very, straight down the line and very pharmaceutical oriented, and they're skeptical, and I think it takes a certain type of a person to be open-minded and to be willing to try it. And because I already practice a form of integrative medicine, where I've already stepped out of the box, it makes it easier for me to practice that way.
As a physician who treats pain, I feel it's my obligation to incorporate any technique that will work. And in that regard, we use a multitude of different disciplines. A percentage of my patients, I use chiropractic. A small percentage of my patients, I find that acupuncture is very effective. A larger portion of my practice, I find that psychotherapy for pain problems is very effective. Also, in a large portion of the pain patients who've had chronic pain, I find that neurofeedback is a useful therapy. Now, I have to emphasize that in the way I use it, it is one of many modalities that are being used, but it's a modality that, when incorporated into a comprehensive program, can make a very big difference for patients.